Despite another year of pressure on NHS finances nationally, we've worked hard to maintain financial discipline while continuing to invest in patient care, essential services and staff wellbeing. The financial year has been another challenging one for the Trust, with the ongoing impact of inflation resulting from worldwide events, the changing government and senior NHS leadership, drugs costs and staffing costs. Despite these pressures and changes, the year has seen continued strong financial results. We have achieved our financial plan through the delivery of a revenue surplus for the 8th consecutive year. We delivered an adjusted financial performance surplus of £19.8 million. Our underlying financial strength remains solid. We generated £2.1 billion in operating income, which allowed us to continue delivering high quality care while also funding important developments in infrastructure, technology and workforce support. This pie chart illustrates how a single pound of NHS funding is distributed across different areas. The largest share, 43p and 41p, comes from NHS England and NHS West Yorkshire Integrated Care Board respectively. Education, training, research and development and clinical trials generates 8p, while other integrated care boards and non-patient care services to other bodies brings in the equivalent of 2p. And here, this graphic shows how we spend every pound. The largest portion, 49p, goes towards clinical staff pay, highlighting the importance of frontline healthcare workers. Drugs costs account for 16p, followed by clinical supplies at 11p, ensuring the availability of essential medicines and equipment. Non-clinical staff pay receives 10p, covering administrative and support roles. As a Trust, we've delivered a waste reduction programme of £110.4 million this year. Of this, £40.2 million came from programmes across our clinical teams. A further £21.4 million was delivered from productivity initiatives across the organisation, including in theatres, outpatients and diagnostics, length of stay, and the introduction of robotic process automation in several areas. The balance was delivered from other Trust-wide cost savings programmes and cost-based reviews. None of this would have been possible without the tremendous contribution of all members of staff across the Trust. This is an achievement that reflects the creativity and commitment of our teams to reduce costs whilst maintaining high-quality patient care. We've made real progress in reducing waste across our organisation and it's delivering results. Through initiatives like reusing part-open medicines, switching to biosimilar drugs and choosing reusable clinical equipment, we're cutting costs and cutting waste. We're reducing our carbon footprint, strengthening our supply chain and generating real environmental benefits, all while keeping patient care and safety at the heart of everything we do. In 2024-25, capital investment continued to be underpinned by our previous year's surpluses. We invested £76.5 million in capital schemes, transforming care for our patients. Key projects include the Rob Burrow Centre for Motor Neurone Disease at Seacroft Hospital, the Electronic Health Record and the Elective Care Hub at Wharfdale Hospital. It's important to recognise that we've achieved all of this against the backdrop of continued clinical pressures and rising costs. That resilience is thanks to the hard work of colleagues across clinical and corporate teams and the strength of our partnerships, both locally and nationally. I'd like to thank all members of staff for everything you've done to help deliver this financial position whilst keeping patient care at the heart of all we do.